All right. So you should be able to see my PowerPoint at this time. We have a lot to cover. I know it's been a challenging week for all of us. I'm going to go over a lot of things. We got out our guidance to you on Monday, and I have found some things that were omitted, and so we'll go over those things and I'll get corrections to you. So again, a lot going on. So as usual, if you're not with the schools or health department, we ask you to drop off and we'll get the slides and the recording onto our website, and just make sure you pass along any information to anyone who needs it in your building. So again, the new quarantine and isolation guidance for schools was sent out and posted on Monday, both from our health department and from MDHHS. Very similar. It follows, for the most part, the CDC guidance. The one difference is MDHHS suggests to test, and the test to stay through day 6, and we recommend the test through day 5, since those that are in quarantine would be able to come back on day 5. So we wanted to keep that consistent. Again, it follows the CDC guidance, which is updated in their school section. It's just much more wordy, but it does follow along with that guidance. So these are some flow charts that I put together. They're not beautiful, but they're done. I did add in some further explanation here, again, some things that were omitted, and I will get some corrections together and sent out with the school talk information later this week or early next week. So just an overview for sick people, so whether you have staff or students who have any symptoms of COVID or who have had a positive test for COVID. If they do have symptoms, whether or not they've tested positive yet, so if they have tested positive or they have not done a test or they're still waiting for their test results, they should be home in isolation. If it's been at least 5 days, so day 0 would be their first day of symptoms. If it's been at least 5 days, they've not had a fever for at least a day, they're largely improved, then they can come back to school. They do need to wear a mask properly at all times, which means if there are activities where they cannot wear a mask, they should not be doing those activities. We know things like lunch and whatnot are very challenging. The answer the CDC gave to that was, well, all along we recommended you distance people when they have their masks off, like at lunch. So basically do your best. If you just cannot space people at all, then you may not wish to go with the shortened isolation. The extra box I put in there, if you have people who are having symptoms and they do get tested and test negative, or they do see a healthcare provider and get an alternate diagnosis, and they're feeling better and they've been fever-free for 24 hours, they can come back to the school. Again, they do give some clarification as to what a negative test is. In someone with symptoms, it would be a negative PCR test, or it would be a negative antigen test if they've been vaccinated, if they've previously had COVID in the last 90 days, or if they otherwise have a really low likelihood for having COVID. They've not been recently exposed, other things that would just make them low risk. And there is an algorithm on the CDC webpage that does explain all that. And again, I will add this to the information and get you a new version out. I just realized I had left that part out, and I know that's a common question that we get. Again, anyone who is unable to wear a mask or unwilling to wear a mask for days 6 through 10 should continue to isolate for a full 10 days. And the same thing is followed if someone does not have symptoms but has tested positive. You just follow day 0 as the date the test was performed. This is pretty busy, but basically if you have someone who meets the definition of a close contact, whether this person is a close contact at home or a close contact at school. If they have tested positive for COVID in the last 90 days, they don't need to quarantine. And the definition here is a little different for school versus non-school settings, but either way, if they're under 18 and have had 2 doses of Pfizer, and it's been at least 2 weeks since they've had those 2 doses, they don't need to quarantine. If they're 18 and older, they essentially need to be fully up to date on their vaccine series. So they need to have had all their primary series and any booster that's recommended. When I mentioned this is for schools, this is what's recommended in the school quarantine guidance. For those outside of the school setting, it simply states that they should be up to date on all recommended vaccines, and it is now recommended that anyone 12 and over get a booster. So for the general public, it states that in order to not need to quarantine, if you're 12 and older, you need to have 2 doses of Pfizer and your booster. They didn't change that in the school guidance. I know it's extremely confusing. But essentially it's allowing you then with your kiddos to let them stay in school even if they've not had their booster.
Dr. Morse?
Yeah.
It looks like a few folks aren't able to see your presentation. I think you kind of go out and bring it back in, and that usually fixes it.
Yeah, I'll try that. Thanks.
Thank you.
All right. So. All right, so hopefully everyone can see now. You maybe wish you couldn't see because it's a big old mess of boxes and arrows. But
thank you.
Yeah, but it's good timing to make sure you can see this because I will add this in there. But one thing I realized just the other day that I forgot to add in there, this was something that we had added into our guidance when we had added the test to stay guidance. This is something different from what the CDC and the state provides for, but it is something that many states have done, and the ABC Collaborative has supported with evidence. But basically for those who do have universal masking, or even if you just have a lot of students that do voluntarily wear masks, if both individuals were wearing a mask at the time of the exposure, so your close contact and the person with COVID, both were properly wearing a mask at the time of an exposure, then that close contact does not need to quarantine. But they should still follow these other guidances of, continuing to wear a mask for those 14 days or 10 to 14 days after. Consider getting tested at 5 days, watching for symptoms. If you want to be extra cautious, they can also follow the test to stay protocol, which we'll discuss here in a minute. But I apologize for overlooking that. Again, that is something that we have offered as an option based on the evidence that it does have, again, those individuals wearing masks with an in-school exposure only have an extremely low risk of infection. And so we have allowed them to stay in school. So I will update our guidance to add that back in, and I really apologize for that oversight. So then if going through things, you recognize that someone does need to quarantine or potentially test to stay because they've had an exposure and weren't wearing masks, weren't fully vaccinated, weren't up to date on vaccines, or they had a household exposure, again, where they were not up to date, that kind of thing. Keep in mind that the test to stay option is only for in-school exposures. It is not for household exposures. So option 1 would be quarantining for 5 days, where day 0 would be the last day they were exposed to someone with COVID. After day 5, so on day 6, they can come back to school, continuing to wear a well-fitting mask through day 10. It is recommended they get tested on day 5. It's not required, but then continue to watch for symptoms. The test to stay option at this point, what's suggested is, let's say you found out that you were exposed to somebody with COVID. Let's say the last day you were exposed was Monday. So day 1 would be Tuesday, Wednesday would be day 2, today would be day 3. So today, if possible, you'd get tested. If not, it would be tomorrow. So before you came to school tomorrow on day 4. Day 5 would be a weekend, so it wouldn't matter. You'd come back on Monday and then through day 10 wearing a mask. Essentially, you want to test them as soon as they get identified as a close contact. If the school day is essentially nearly done, just test them in the morning before they attend school or before they attend a school function. And then every other day until and including day 5. So again, if they found out on day 3, in the end of the day, you test them in the morning of day 4. And then since the next day is day 5, you test them in the morning of day 5, and then you're done. If you found out the very next day, you test them the morning of day 1, the morning of day 3, the morning of day 5, and then you're done. We just want to make sure and test them on that last day of day 5. Obviously, watch them closely, but hopefully, you really will not need to test them very often. But this will give you a way to keep those kids in school and completely eliminate the need to quarantine those individuals that were exposed in school. And just a reminder, if someone has been exposed to COVID and tests positive on antigen testing, you do not confirm that with PCR tests. And it ends up causing a lot of confusion. So if you're doing test to stay and you're testing those exposed people with antigen testing, if they're positive, you're done. They have COVID. You don't need to send them for any confirmatory testing. This is a bit busy. I was trying to find ways to give you some visuals of determining if someone was up to date on their vaccines. This again is just for schools because I mentioned those that are 12 and over, they do recommend or they do advise that that booster is needed to be up to date, but this gives you a little more leniency with those school age kids. I'm going to change this down here. These boosters will just say booster because there is that option to mix and match. So someone who's had Pfizer doesn't necessarily have to have a Pfizer booster. They could have Moderna or even a J&J vaccine. So I'm going to change these to say booster. Right now, these say 6 months. I'm going to change that to 5 months because kind of in transition of doing all this, the CDC changed this from 6 months to 5 months. So, so again, we're trying to keep up to date on everything, and it is a bit of a challenge. But again, just trying to give you a little bit of a visual. My main message to all of you is just do the best you can. If someone says they're up to date on their vaccines, I don't expect you to try to figure this out on your own. We're getting to a point where this just needs to become part of everyday life, and I want you to try to find a way to not spend your whole day doing COVID, even though they're seeming to make it more and more complicated. For household exposures, again, the test to stay does not apply to household contacts because the risk is so much higher there. The infectious period is still that 2 days before symptoms start or their test date if they had no symptoms until 10 days after their symptoms start. It's just that they're most contagious just before and just after their symptoms started. The household contacts quarantine period is 5 days from the date they were last exposed to a contagious household member. So if the household member can quarantine, or I'm sorry, can isolate completely away from the other family members, and on days 6 through 10, they do consider that being fully masked while in the household. If they can do that for those 10 days, then the quarantine for that family member would start right away. So they'd only have 5 days. But if you're dealing with like a little kid or, you know, somebody that can't stay isolated away, it's still gonna, their quarantine's still gonna start on day 11 because they can't isolate away. So just to let you know that that still is the same. But again, if your sick person can isolate for days 1 through 5 and either isolate or at least stay fully masked while around the family members days 6 through 10, they can shorten their quarantine. I know that's been a question. So, and I'm going to go over this a bit, I think, in the next slide. Yeah. So with everything changing and there's still more changes coming, if we have parents or staff calling us for guidance of when they can go back to the school, especially if it has to do with quarantine, we are going to tell them to follow what the school says because there is such variation. We will give them some basic guidance if they're not sure, but again, we'll tell them that the school may give them slightly different dates and to follow what the school says. So I just wanted to state that if there's any issues, because we do have a lot of people working on cases, make sure and let us know. But we're not giving people return to work or return to school dates really. And that's where this next slide comes in yesterday. Again, there is now kind of the shift towards basically treating this more like influenza in the way that it's being handled. So getting away from trying to investigate every single case, trying to notify every single close contact, and really focusing more on large outbreaks or really high risk settings. So if there's an outbreak in the school or an outbreak in a long-term care facility, things like that, rather than trying to call every single person and trace every close contact. Because honestly, we're really only reaching an infinitesimally tiny percentage of those people. And by the time we do it, they're already doing what they need to do, or it's too late to really do anything about it. So the state is actually ending their help in investigating cases. They're ending their programs that they were using to follow up on close contacts and things. So that's all going away. They will help if we need it with outbreaks, but they're really going to focus more on educating the public on what they need to do when they know that they're infected or how to contact their own close contacts. So there'll be more education towards the public coming soon, but just so you're aware that there is going to be a shift. So that's why I say for you guys, just do your best. Try to find a way that this becomes part of your day-to-day activities rather than a huge focus for you. The message they gave for schools, so this kind of messaging will be coming towards you. This is actually from a message to us, but I wanted to make sure you were aware of it. So one of the biggest message, again, kind of think how we think with influenza or chickenpox or any of the other communicable diseases. The big thing is if kids are sick, they need to stay home, and same with your staff. And stay home long enough that they're not going to come back and spread it. And that parents and staff tell you that they're sick and what they're sick with. And they should be doing that with everything, whether it's strep throat, influenza, or anything. So again, trying to get this as part of our other normal routine illnesses. And then, trying to keep schools open. You do right now want to try to keep screening people for illness and keeping people home if they're sick, trying to identify close contacts to prevent spread as best as you can. We know how difficult that is. And in terms of notifying contacts, using form letters, using mass phone calls, things like you would do with other communicable diseases, and following guidance as best as you can. We know that there's just so many right now. In that vein, there are 3 different updates to some non-governmental guidance here, just giving, again, good reviews of how things work well. The middle one, the Strong Schools North Carolina, that is guidance that the ABC Science Collaborative has really helped with, and they just updated it. I'm going to send that out when we send everything to you. It's just great. It essentially follows everything that we're recommending, and it's like a more detailed guide of keeping things going. I mean, it's 25 pages, so it's just probably more than you want to know, but it gives some really good guidance if you want more information. These are a couple pages from that guide, and I actually have already copied and pasted them into our document, but it goes through each individual scenario, whether you've been diagnosed with symptoms, without symptoms, or you have symptoms and have been diagnosed, or you've been exposed with vaccination, without vaccination, different things, and then what to do. So it's extremely detailed, and again, I'll include that in there. So a few more updates. We did get an email, and it was supposed to have been sent to all of you. So if you didn't get it, maybe somebody else in your organization did. But just an email saying that there's a shortage of the antigen test Binax Pro, and those that have been identified as being at high-risk schools will be getting a different test called FlowFlex. And so there was some more information in there about that test. So again, somebody at your school should have gotten this email. We have it if by chance you did not get it and you need more information. As always, though, if you have questions, it's that same email as it's always been, and you can always shoot them an email. I also wanted to share that yesterday, the White House put out a release that they are going to be increasing testing to schools. So another big push of testing for schools. So if that's something you haven't started doing, again, that is a big push to try to help keep schools open. So I included the links for the CDC testing, has a lot of resources there, and then the state testing information and ordering form. So that's kind of my local updates. For our local data, as a reminder, you can go to the mystartmap.info. The state data and modeling update for this week, we've been seeing really dramatic increase in case numbers like the US has, but luckily deaths have actually been decreasing, which supports that, highly contagious nature of Omicron, but less severe. Unfortunately, the hospital rates are quite high. Even though it seems less severe, there's just so many cases, it tends to balance out, and we're having a lot of trouble with healthcare workers getting sick and having a lot of staff shortages. So here are the case counts, the weekly case counts per 100,000 in Michigan. This is throughout the whole pandemic. And so you can see where we're at right now, almost twice as high as we've been to date. So just really, really high case levels. This is the daily case rate averaged out over 7 days on this line, and the gray bars are daily. So again, you can see how high we are. This is hospital bed use on the top right. So increasing, but not to the rate as it is for cases. And then, I'm sorry, this top left is positivity, and the bottom is the case rate. I'm sorry. The bottom is the death rate, or is the total number of deaths, which again is down, so that is at least a good thing. This is the comparison of last year to this year. The light blue line is this year, and again, just so much higher. These are the age groups, and again, our young adults, 20s to 40s, are the highest groups, and unfortunately, the 10 to 19-year-olds are now our fourth highest group. Over 15% of all visits in the ER are for confirmed COVID. So, unfortunately, those who have other health issues are going to have trouble getting a bed. Hospitalizations are higher now than they have been throughout the whole pandemic. ICU use is starting to creep up again, and our pediatric or child hospitalizations are going up. And again, it's, there's so many cases. If you have a certain percentile that are hospitalized, that goes up too. This is the Omicron count. So 98% of all strains that are genotyped in the US are Omicron. This is Michigan. I pulled some numbers from last week. Last week, it had only been identified in 18 counties, and now we're up to 41. Just before we started this call, I got an email of several more that had been identified. In the last week, about 70% of all the strains that had been genotyped were Omicron, and that's about 2 weeks behind. Last week, it was opposite. Almost 70% were Delta. So just in a week's time, you can see the difference. So pretty much everybody working in COVID right now figures that Omicron is around 90% of our cases. It's just we're about 2 weeks behind in getting that data. This is a new visual the state has, just kind of reminding us of the things we can do to prevent and handle COVID. So our prevention, and then our identification and treatment options. And just a little bit on treatments. Unfortunately, 2 of our major antibody treatments don't work against Omicron, and there's a couple that we do have, but unfortunately, there's not a lot of it, and you can only use them IV. We had one, the Regeneron, which you could use as just a shot, which made it much more available. So unfortunately, that has happened. There are 3 antivirals. The oral medications are just starting to become available, and then there's one that's only for IV use in the hospital right now. So that's all I had for my update. Kill me if I do that. I'm going to stop sharing, and I will get to questions here. If you have any, please feel free to type them into the chat, and then I'll get to questions asked over the line for those who might not have access. So in regard to rapid testing, will a person who has had COVID within the last 3 months still test positive on a rapid test for up to 3 months, or is it just the PCR? Typically, it's just the PCR, but it is recommended that people who have been positive within 3 months, if they have no symptoms, they should not be tested again within 3 months. And if they do have symptoms, they should follow up with their healthcare provider for guidance as to whether or not they should be tested. If an employee is positive for COVID and isolates for 5 days according to CDC guidelines and takes a rapid test on day 6 and is still testing positive, are they still contagious? Should they return to work wearing a mask? Again, there's been debate about testing to return. It's not recommended because one is we don't have enough tests to do that. The other is we know that about 1 out of 3 people are still going to be contagious after 5 days. I mean, the CDC has that in writing on their website. But that's the rationale for wearing a mask. And their argument is that they're going to be a lot less contagious. If they did happen to do an antigen test and were still testing positive, you certainly could say, gosh, I'd feel safer if you stayed home for the full 10 days. But again, these guidelines are based on the CDC openly acknowledging, yes, 1 out of 3 of them are still going to be contagious after 5 days. They're just a lot less contagious. And if they wear a mask, that dramatically reduces what little contagion they still have. So again, this is one of those risk-benefit things. If students are an out-of-school close contact, please give them dates. So again, we are not going to be talking to all our individual case investigations are not going to be continuing like they have. So and even as it was when we did do individual case investigations, we would maybe get replies from 5 to maybe 10% of people. So we literally could not give them dates because we never could talk to the person who was positive to even know who the close contacts were. So we know it's frustrating for us to not talk to them and give them dates, but when people don't answer their phone and when they do, they refuse to give us names, we literally cannot give them that information. So that's why, I mean, at this point, we just have to really do the best we can do. Does it matter if the booster is not done right at the 5-month mark or after that? The vaccines can be given later. If they're given too early, they may not work. So if you have any questions about anything with vaccines, just give us a call. Again, I certainly don't expect you to figure any of that out. It confuses us enough. But the main thing is if it's been 5 months and they have not yet gotten the booster, they can't be considered up to date. And that, I just, as a general note, that goes for any vaccine. You can get any vaccine late, you just can't get it early. For the test to stay, if a fully vaccinated student is able to be completely away, fully vaccinated, and is asymptomatic, are you still advising? So if you have a fully vaccinated student who has someone sick at home, they do not need to quarantine at all. They still follow the CDC guidance that if you are up to date on your vaccine or you've been diagnosed with COVID in the last 90 days, you don't need to quarantine. So, and then if they were able, if the household contact was able to isolate away and that kiddo was not vaccinated, they'd only need to quarantine for 5 days. So if you have more questions about that, let me know, but I just want to make sure that they don't stay home more than they have to. What about the HRA folks? I have not heard anything about that recently. I thought they were, so yes, we do, depending on what district you're in. I know Mid and District 10 have HRAs. We have a few in Central as well. They're still there to help you. If you have one, if you wanted an HRA and worked with the health department to hire one on your behalf, then they will still work with you and help you. I know a lot of effort now is going towards testing and things. So, but we had some schools that said they didn't want one and may not have one to help them out. So the funding for the HRA ends in July. Was the next question, was, is the funding going away? But yes, they're still there and still helping. We cannot take on outside exposures. We are struggling. No, and we didn't ask you to take on outside exposures. How long should an individual wait to receive a booster following a positive diagnosis? As, as soon as you're out of isolation and you're feeling well enough, you can get a booster, as long as it's been enough time. So can we, the schools, then suspend detailed contact tracing reports to DHD-10? Yes, I do believe so. I don't know if anyone from DHD-10 is on and wants to comment to that. We are in a little bit of limbo because the state just kind of dropped this on us, but didn't give us like a specific, here's how you're going to do it. The other thing is, just as a reminder, there is an executive order about reporting cases. We have to report to you and you have to report to us, and then you have to put it on your dashboard, which a bunch of us asked, you know, is that going to go away now? And we haven't gotten an answer back yet. So I don't know if Annette or anyone from DHD-10 is on. Can those schools stop sending the contact tracing lists? Well, I'll make sure.
I'm sorry, Dr. Morse, this is Sarah. I don't believe Annette is on. I will clarify my statement, but I believe we have made the decision that we are not entering contacts into MDSS. I think there is, we are continuing with case investigation for the school population, and that is what our HRAs are doing now. The majority of cases coming in are school age populations, so that's what HRAs are doing right now. And but I will get with Annette and we'll send out something to the school superintendents.
No, we are not needing those lists because there's nowhere to put them. No one's going to be able to call all of them and follow up.
So, and I did try to clarify this before the call, and it's hard with the 3 different health departments, but I will see if I can't get the 3 different health departments, if they have any other information they want sent out with all of this information, just to make sure I haven't given any misinformation, but we'll try to get it all. That way you're just getting one email. But yeah, in terms of close contacts, at least, it's more for you to be able to notify individuals. But yeah, we aren't able to follow up on them any longer. So Penny was asking about the testing email. I will write myself a note to make sure to include that email with all the other stuff that will be coming your way. Is there a new reporting form for the schools to use if a parent calls in and reports that their child tested positive for COVID, or do we just do it on the communicable disease report that is due on Friday? So I will add that. I will, again, have each health department clarify how to report. My assumption is, at least for now, continue doing it as you have been doing it, but I will have them clarify. So could you create a household contact flow chart to illustrate how to isolate and not able to isolate? Okay, I gotcha. Yep, so I'll make a flow chart regarding households where you might be able to isolate or not isolate. All right. And then, does your response to getting the booster for those recovering from having COVID apply to students 12 to 16 years of age? It does. There are some variations if by any chance someone with COVID did happen to have myocarditis as a complication of their COVID illness. So if there's any questions ever, they should talk with their healthcare provider or they can call us. But yes, in terms of when to get vaccinated, when to get second doses, when to get boosted, you can get it as soon as you feel up to it and you're no longer in isolation. because we don't want people coming out of isolation. But, again, those are conversations we encourage people to have with their own personal health care provider if they have concerns. Unvaccinated students with COVID in last 90 days. Family member has COVID at home, student attends school masked, right? Right. If a student or anyone else has been diagnosed with COVID by a positive test, and that can be an antigen test or a PCR test in the last 90 days, regardless of where they've been exposed, they do not need to quarantine as long as they're not having symptoms. All right, so right now, as of now, there's no more questions in the chat. So if anyone wants to unmute and ask a question, feel free. I know this is really confusing. We have had a very bad week, and I'm sure you all have too. If the school does not have a mask mandate at this time, are they able to follow the new 5-day guidelines, assuming the person will mask? Yes, you can. Again, if particularly for the isolation, if they will properly wear a mask from days 6 through 10, they can come back. We know how challenging it is to make sure that they comply with that. But if they won't, if you know they won't or they can't, then you need to have them stay home for the full 10 days. But short answer is yes, you can. We also know that, and I meant to make a slide of this, but we know that there's getting to be large amounts of cases and other illnesses going on, and some are needing to close or think about closing. I know getting people to wear masks is extremely difficult, but I once again encourage trying to encourage masking or recommend masking or whatever you can do as an effort to keep your schools open. Catherine, did you have your hand up?
I did, but I figured it out. Sorry.
Oh, okay. No, you're fine. So then how are the schools handling I'm assuming you meant 5-day quarantine with return to school with elementary students? They don't leave masks on, etc. Yeah, and that's, I guess I could let other schools chime in. But I guess it's just your comfort level and how well you can continue to educate and instruct those kids to keep the masks on. So the next question was just a clarification. We are not contact tracing to the health department, but we are still supposed to quarantine students who are close contacts. That is the recommendation. What we would do when we got names of close contacts was we would put them into a system, and then the state followed up with them, mainly a call and then some text messages. That is going away, and there just isn't the manpower to do that kind of thing. I know we're kind of in this limbo land. The way I'm trying to see it is similar to how we would respond to other communicable diseases in the school. It's just different, which I know I'm not making a lot of sense, but if you can get to a process with form letters, things like that, it's challenging. I know it's very, very challenging, but we as the health department didn't do much with the close contacts when we got the information. I really don't know what else to say. I know how frustrating this is right now.
Dr. Morse, you mentioned that there might be some pending changes that would just essentially eliminate the contact tracing process and the quarantine process altogether. And I hope I'm not speaking for myself on this, but it certainly feels like we're the last entities who is really doing contact tracing and really doing any type of quarantining behind it. And I'm very hesitant to change to this updated guidance if there's going to be a pending change coming pretty soon. So can you speak a little bit to that and when that might happen? Because this is very confusing and it needs to be much simpler if we're going to make a change around here.
So contact tracing, well, quarantine recommendations are not going away. The efforts of the health department trying to investigate every single case and trying to find every single close contact and tell every close contact to quarantine is going away. And so the new emphasis will be on educating the public that if you're positive, here's how you can notify your close contacts, and here's what your close contacts should do in terms of quarantine, that kind of thing. So the recommendations to quarantine, as we've just discussed and as the CDC has just updated, is not going away. It's just how that is getting communicated to close contacts.
So on that front,
and I don't know how to.
If it's a school contact, and let's say it's a student here, is that then being placed then on the parents to go through and talk with their kid to determine and notify close contacts? You said you want us to be doing our work again. Well, it's been weeks since we've been able to do work because of the Omicron variant. I'm trying to understand how to place my people and their priorities on this right now.
Yeah, and the information I gave you from the state is about what we have. We don't have specifics on how this is supposed to work. So I would encourage you to reach out to your state leaders because I don't know how else to guide you.
Dr. Morris, this is Kathy again. In regards to the question in the chat box from Mary about being confused on the non-contact tracing. So I have 4 contact tracers, 8 NRHs that are working with our school districts. My hope is that they continue to do that, but do they not now need to report the documents to you of all the contact tracing and the positives that they obtain every day? That form does no longer need to be sent to you?
We still need to be notified of positives.
But not close contacts?
But not close contacts.
Okay. Thank you.
Any other questions?
Dr. Morse, one question going back, and I don't remember what slide it was. It had to do with option 1, option 2, close contact to COVID-19 is identified as needing quarantine or TTS. Quarantine for at least 5 days after their last close contact. I know that's referencing students, but can we apply that to staff as well?
Yes.
Thank you.
So the next question was, we would report to the health department like we would for a positive measles case. So yeah, COVID is a reportable illness that you have to report to the health department within 24 hours, just like any other, just like chickenpox, measles, pertussis. So yes, you need to continue to do that.
And that would be the current form that our staff is using. We don't have to go into a different system where you would report things like measles. Just use the form that we're currently using.
I assume so, and I have to plead ignorance since I'm not doing the day-to-day work. My nurses are. So you will be notified if anything like that changes. But I'll talk with them and make sure that anything different on the day-to-day activity, that when we send out all the materials from this, it gets sent out to you as well. But I'm sure none of that has changed. So, all right, there are a few more questions that came in. So the guidance that came out from us in the state is what is recommended. There's also a page on the CDC that gives guidance for how to handle cases in schools. That's all what's recommended you do. Again, as we've gone through before, none of this is the law and none of it is anything you have to do, but this is just how it's recommended you handle COVID in your school at this time. I don't know how better to explain it. We're very frustrated as well because we know this is not, it just seems to have gotten so much more complicated all of a sudden instead of getting easier. So I don't know if you have people at the Michigan Department of Education or something like that that you can talk to see if they can't give you better guidance. Because again, going through this, it just seems like it's gotten more complicated. My concern is, given how contagious it is and how much there is, I don't want to see schools having to shut down because of illness either. Do HRAs still have to contact parents if their students were close contacts? I think the HRAs do what the schools find is most useful for them to do, if I'm not mistaken. Again, I'm not supervising HRAs. I'm more of a medical big picture person, so I apologize.
Dr. Morse, if you'd like, I can speak to that.
Okay,
Hi
thank
guys,
you.
my name is Marie. I'm a COVID response coordinator for DHD 10. The HRAs work with the schools closely, and each school has a different preference. So some of the schools do prefer that the close contacts are contacted by the HRA themselves, and some we put into MDSS, which would then go to Trace Force, and Trace Force was calling them, but Trace Force has been discontinued. So that part is no more, and the close contacts will not be contacted, but they will continue to call the positive cases for your school.
Thank you. All right. So from county to county level, if you have functional or questions about how things are working, go ahead and ask your local nurse or your local HRA. Again, you're talking to 19 counties. I'm kind of a big picture person. Any other questions before we end the meeting? So this recording will be available. I wanted to try to get everything else together. My hunch is it'll get out on Monday, but if you need it sooner, I can probably get just the recording to you sooner. whether it be the school district or HRA notifying parents, still need to know. Right. And so again, I know with other communicable diseases, often the schools send a letter home to parents. And we've provided letters in the past to have available as a form letter. You can alter, if we need to update that again, we can, but I know that's what a lot of schools do is they send a form letter. I don't know if talking to your other schools to see kind of how they're doing it. Catherine, did you have another question?
No.
Okay. All right. Any other questions?
Dr. Morse, this is Kelly.
Yeah.
Hi, and on the MIHAN that we got, it says for school administrators to screen students for signs and symptoms of illness, ask parents and guardians to keep ill students home. If the school becomes aware of a COVID case, identify students and staff that may have been a close contact of them, and notify staff and parents and guardians of the exposure in the classroom setting.
Right, which that's what I had on that slide. I think the issue is just how are they to functionalize that. So the next question was, what do we do about presumed positive kids who never tested and have been exposed? So if you remember, there was one that said if they have symptoms and tested positive or never got tested. So if you do have kids that that have symptoms but never got tested, whether or not they were exposed, they would isolate for 5 days and then come back on day 6 if they're fever-free, their symptoms are largely improved. So that is in that catch-all. All right. Well, if we get any information from the state that gives any better ideas, we'll let you know. But again, I know most schools have been sending letters to close contacts or calling them or doing like a robocall. I don't, again, I'm not on the ground with you guys to be able to tell you how to do these things. I just wanted to share with you what is happening so you're not broadsided by it. But I will make those changes that I discussed to our information so you have it, and then add in that extra flow sheet and some other things that we talked about, like that email, and get them out to you as quickly as we can. If you have questions in the meantime, make sure to let us know. Hang in there. I know it just doesn't ever seem to get better, but we'll keep hoping. I hope the sun is shining where you are, and have a good weekend. We'll talk later. Goodbye, everybody.